Hello, in this speech I will inform you of the reasons why nursing is very important. William Osler once said, "The trained nurse has become one of the greatest blessings of humanity, taking a place beside the physician and the priest." Also, Santa Monica College says, overall, nurses can assess patients' health problems and needs, develop and implement nursing care plans, and maintain medical records. Nurses administer care to the ill, injured, recovering, or disabled patients. They also advise patients on health maintenance and disease prevention or provide case management. As a CNA at the Stafford County Hospital, I work alongside with many different nurses. I also do job shadows with different nurses to figure out what specialty interests me most. Because nurses have such high qualifications, they regularly save lives and are an essential part of the medical professions. Nursing is a very important career, and I believe that everybody should learn about it because most likely everybody's been to a hospital or a clinic, and the nurses are the ones gathering your information and giving it to the doctor. The doctor will then diagnose you, and then the nurses will take care of you from there. And so, since they're the ones taking care of you, I believe that you should learn about them and what they do. Also, it helps you understand the inner working of your health care. Now let's take a look at what nurses have to complete before they're even allowed to touch a patient. Before a nurse is allowed to even perform the most unexciting task, he or she must be trained, certified, and highly qualified. Doing these things is no easy task. JHI staff says, training covers everything from best practices in routine care to intensive care, to patient safety, and all sorts of specialty care. So there are a lot of hoops one must jump through in order to make it to the first day at the hospital. In addition to a large amount of training, becoming a nurse requires years of schooling. There are different types of degrees. You can get an associate's degree, a bachelor's degree, or a master's degree. An associate's degree is a 2-year program, normally at a community college. A bachelor's degree is a 4-year program, and then a master's degree is 6 years of schooling. While doctors are trained, qualified, and capable, nurses do the work that the doctors do not want to do or do not have time to do in order to save lives. Because doctors have to juggle so many patients, nurses spend more time with the patients than doctors do. Nurses get to know their patients and learn their pain levels, their life stories, relationship histories, and flat out understand the patient better. When doctors come and talk to patients, on the other hand, they only talk to patients for about 2 minutes. So nurses spend hours and days with people making sure they are comfortable. Nurses are the real doctors of the hospital because they care for patients as a part of their own family and make sure they have everything they need. The difference between nurses and doctors is that doctors confirm a diagnosis while the nurses are the ones to treat that diagnosis and take care of you. While the doctors are running around, staring into their pagers, nurses are the ones getting to know the patients and saving their lives, which makes nurses a very essential part of the hospital. Nurses need to get to know the patients for a variety of reasons. There are so many. One reason is to learn the patient's personality. If the nurse does not know the patient's regular behavior, the nurse cannot know if the patient is acting differently after being placed on new medicine or coming out of a procedure. Getting to know the patient's personality takes time, which is why with the 2 minutes they spend with each patient, doctors are incapable of performing this task. If the patients are acting differently, it normally means things have either gotten worse or better. Another reason is if the patient is comfortable, they are most likely to be truthful. So let's say that one of the patients is a smoker and he is having lung problems or breathing problems and the doctor does not know that he smokes. So if the nurse makes him comfortable, the doctor, and he tells the nurse what is going on and that he is a smoker, then that can help the doctor diagnose the patient better and treat the patient better too. Nurses use the knowledge they figure out from the patient after they're comfortable to figure out why something has happened to their patients and to fix it before the doctor makes a wrong diagnosis or puts them on the wrong medicine. Nurses save lives because they get to know every detail about their patients. And it also helps the doctors understand the patients better if the nurse knows what's going on. Since the nurse is the one going to explain what's been going on with the patient and the personality, the doctor can get a better understanding of that when he walks in the room. Overall, doctors and nurses have the same goal, and it's to save the patient's life, to make sure they're comfortable and they're cared for. They have to work as a team, the doctors and nurses do. The doctor orders the medicine, but the nurse is the one to give the medicine in the right amount of dosage and make sure that the patient is taking the medicine properly. Like I said earlier, with the 2 minutes that doctors are there, doctors can give good and bad news. But the nurses are there during that good and bad news or after, either holding hands, comforting, or even celebrating with the patients. Nurses are the heart of the hospital because they care about the patient's safety, care, and health. And this is why my future career in nursing is very important.